research from right here in Las Vegas suggests that many baby formulas contain too much of a good thing.
Yeah, that study from CSN finds the majority of the food American infants are eating couldn't be sold overseas. 8 News Now investigator David Charnes with those results and asking why.
And Brian, this study says more than 80% of the infant formulas researchers at CSN tested showed high levels of 2 minerals. Now, that's not necessarily a bad thing, but it highlights how what parents here are feeding their babies, that formula can't necessarily be sold over in Europe. Researchers at the College of Southern Nevada finding variations between what infant formulas are acceptable here in the United States versus what's sold overseas in the European Union.
And the reason why this is important is 75% of kids in America are on formula by the time they're 6 months old. So we're giving them or fortifying the formula for health reasons, but you can also fortify the material with too much.
The study looked at about 24 different formulas, finding more than 80% exceed levels of iron and zinc. According to CSN, those minerals, often fortified in American-made formulas, are too high to even sell in the EU. Too much, according to the study, leading to developmental impacts and gastrointestinal distress. Dr. Doug Sims is CSN's Dean of Science, Engineering, and Math.
You can ingest iron and zinc for health reasons, but there is a maximum level based on the body size. And when you're giving large amounts of iron and lead to young kids, especially infants, you're going to actually oversaturate them.
The study also researched what's in cinnamon, a common spice added to baby food.
So when you're making baby food, think about what you're putting in it. We found that ground cinnamon is more likely to have contaminants, not just of lead, but of iron, zinc, manganese, versus the stick cinnamon that you can purchase and grind yourself at home, which actually had virtually no trace metals of concern.
Sims says those young bodies will likely process out anything that's overloaded, but he questions what it means that food sold here wouldn't fly in other countries.
I think our government should get more involved. The Food and Drug Administration, as an example, if you look at our food, we don't have a lot of maximum contaminant levels that are allowed, which that means it's almost an open season to have whatever's in there. You go to the EU, they have maximum contaminant levels or tolerable levels that people are allowed to have in their food, which then regulates it.
All that research right here in Southern Nevada at the College of Southern Nevada. So we found out of 27 vitamins and minerals that our government requires these formulas have, the federal government sets a maximum level for just 8 out of those 27. It says that right on their website. So I asked the FDA why there's this discrepancy between what's allowable here compared to over in the European Union. And a spokesperson said they actually just closed a comment period to possibly now change all of these regulations. We do have a link to that on 8newsnow.com. I'm David Charnes, 8 News Now.
Also here tonight, the study didn't name any specific formulas or brands, but it involved about 24 sold at big box stores and places like Amazon. The 8 News Now investigators contacted about a dozen formula producers for their response to these findings, and not one returned a request for comment.